There's been a lot of talk about health care in the debates over the last 2 days, the Democrat debates, and in the first debates, too. And we thought we'd turn our attention to that for a little bit this morning. And with us to chat about it, the man who's written the book on Medicare, on maximizing your Medicare, and he knows about that and health insurance because that's his business, part of it anyway. And we say good morning to J.O. Jay, good morning to you.
Good morning, Art. Beautiful day today.
Hello, Jay. There you are. Good morning. So I have to start out by asking, we're hearing all of these proposals about, Medicare for all, and they're debating within the debates about health care and what's the best way to go. So let's start with the private health insurance that's offered today versus Medicare. Do you see that system changing in the future? Do you ever see private insurance going away?
I think what you're seeing on TV the last couple of days, points out the fragmentation, the mislabeling, if you will. It's not clear to me whether or not the audience fully understands the implications of the different proposals out there. Medicare for all would eliminate all private health insurance, all of it. Literally. That includes not only individual health insurance you buy on the exchange, but it would also eliminate your employer-provided health care. The health insurance benefits you receive from your employer, that would all go away under Medicare for all.
It would be universal health coverage provided by the government, in effect, right?
That is correct. So,
and I guess, my first question about it, and I have to be honest about this, and Jay knows me, I'm on Medicare, and I have a supplement plan which covers all the deductibles. So virtually when I go to the doctor or have medical issues, nothing out of my pocket. Now, I'm paying for that through the cost of Medicare and the cost of my supplement. But even at that, I have to admit that it's better insurance than I had in the private marketplace. But but I'm not a fan of getting rid of private insurance, and I don't think we can afford Medicare for all.
And what you brought up is, a number of interesting points, which is Medicare is very confusing. Crazy people like me have, written books about it and spoken, extensively about the topic. And while largely misunderstood and confusing, difficult, amazed people describe it, the fact is that once persons receive Medicare benefits, once they understand, once they get over the hurdles of enrollment and all of the rules and jargon, once their landing point, the consumers, yourself included, and people from all different types of backgrounds, they are highly satisfied with Medicare. Highly satisfied with Medicare.
And we should point out, I think that it varies from person to person, because my personal experience with my individual plans as I have versus someone's experience on, say, an Advantage plan, where they tell you who you have to see and things of that nature, might be different.
That's true. Even taking that into account, that I think that what many consumers do not fully understand is that, or fully understand how powerful it is that the market is very competitive. There are lots of insurance companies offering these plans. They are competing, and they are competing fiercely. That is to the consumer's benefit, meaning that even when you have to deal with networks, that the networks, especially in the local listing area, very, very good, meaning that the number of holes in there, the details are manageable. So the end result, the end point, as I stated earlier, ends up being a place where the cost and coverage to a Medicare Advantage, as well as, of course, a Medicare Supplement policyholder lends to a great deal of satisfaction, as you've experienced, Art.
Yeah. So let me ask you to look in the J.O. crystal ball
Right.
When all is said and done, even if we get a Democrat president, do you see anything changing?
I see Medicare for All difficult to implement because it is very disruptive for the persons who are on employer-sponsored health insurance, benefits insurance for families, for example. We know that the deductibles are high and the out-of-pocket costs can be high for persons who are ill. Nevertheless, the idea of disrupting that will be very difficult. In addition to that, what has gotten almost no mention over the past couple of days is you have a healthcare system, and that means providers, your doctor, your hospital. What is not really well known by most people is the fact that when doctors are paid by Medicare, hospitals are paid by Medicare, it is a much lower rate than from their employer-sponsored plan or an individual health plan. If all of those persons all of a sudden are being covered by a universal health plan, that will leave the government as the sole determinant of what the fees are. So you're talking about a large number of other stakeholders in our economy who are going to be very, very unhappy about
well, you'd almost have to go to a system of universal budgeting within geographic locations, wouldn't you? I mean, that's what Canada does, don't they?
Exactly. And you may know, not far from the listening area, this is a problem because small community hospitals have a difficult time now. So extreme, in fact, in one instance here, isolated instance, but you can see it as an illustration, which is they accept the PPO from a carrier. They don't accept the HMO from the same carrier. This is a hospital. To give you an idea on how carefully they are managing this entire situation about payments to doctors and hospitals. Very, very challenging is the bottom line. And so if you try to disrupt that entire amount all at once, I think you're going to have, substantial pushback. The American Medical Association, the AMA, is already out there stating its objection to Medicare for All.
Yeah. All right, we're going to take a break, come back, and we'll spend a few more minutes with J.O. talking about health care and potential or lack of it, health care reform. All coming up on the Art Lewis Show. We are at the... All right, back with you here on the Art Lewis Show from the Bay Civic Arena, where the Friends of the Bay Library are putting on their annual book sale for the 45th time. We're talking to J.O. We'll spend a few more minutes with Jay about health care. It's been a subject of the Democrat debates, and it's been a subject outside the debates for a long time. We're kind of, it seems to me, Jay, right now anyway, we're in the kind of no man's land of health insurance. I mean, Obamacare has been stripped down a little bit. We don't seem to have any kind of replacement for it. Where is it all headed?
It'll be interesting to see what ends up happening with the debates and how this entire nomination process works out, because we didn't discuss the second alternative, if you will, being proposed, which is, let's just call it Medicare buy-in or Medicare for more, public option. You see a lot of different terms. It's going to be very interesting, I guess, maybe only interesting to me, Art, but I have a question on whether or not the audience, the voting population, will be able to distinguish plans that have labels that look the same but actually work very differently. The public option would basically allow those persons who cannot afford the Affordable Care, individual health insurance under the Affordable Care Act to be able to access something that looks and feels a lot like Medicare, if not the Medicare plan, the Medicare system itself. and you see variations on this. Buy-in, which basically would lower the eligibility age, for example, is one being proposed by some. There are some incremental changes to the Affordable Care Act, which will have elements or access the existing Medicare system, which then has the ripple effects of how are you going to fund this, because persons like you in your age division have already paid for Medicare Part A, which is hospital insurance, through payroll taxes. Well, all of a sudden, if you increase the accessibility, if you widen the eligibility for Medicare by having younger persons or persons who could not otherwise afford, well, it's still coming from the same money.
It all comes out of our pocket.
Or it comes out of your pocket, in one way or the other.
Well, everything comes out of our pocket. Everything comes out of our pocket, because even Medicare, government doesn't have the money. We give government the money, they spend it. So it all comes out of our pocket.
Yes, it's just that what will happen is that there are going to be a larger number of recipients, and maybe dramatically so, immediately.
And yeah, which means fewer people supporting more people.
Yes, and we have this issue now in a broader sense in our society. So the question then becomes, okay, what would the ripple effects of that be? Whether, for example, if you increase the population of Medicare enrollees immediately, instantly, would you not have to lower rates to doctors' hospitals? Would you weaken benefits? I don't know. That is the unknown here, which is that we're not exactly sure what the balance of these is. So it's very attractive, I'm sure, to many in the listening audience to hear of different alternatives. We have to find a solution for health care. We don't understand health insurance. I can empathize with that. That all said, just to say that any system is better than the current system is going to be introducing a bunch of different other ripple effects and maybe unintended consequences that people have not thought completely through, or the candidates.
Yeah, because, listen, it's easy to say we're going to give it to you for free. Everybody loves free.
That part has an appeal, no question.
There's no doubt about it.
Right.
But, when you stop and think about it, it's a whole other ballgame. Listen, Jay, we're going to do this again. We get down the road here another month or two, and maybe we get a little more clear picture of what things are going to look like. We'll spend an hour talking about it.
Absolutely.
And when does
people to stay updated on these issues, there is a Facebook group under the book called Maximize Your Medicare on Facebook. There's a closed group where I'm keeping persons, updated on different headlines and how it could affect individuals, how it could infect the system. This debate's not ending anytime soon.
Yeah. And when's the new book come out?
Well, as you probably, as many know, a publisher has purchased the book, so I have actually already submitted next year's version, but now we're into the production delays of the traditional book publishing industry. So there's going to be some lead time here. February is the target date, but updates everywhere online, MaximizeYourMedicare.com, and a free newsletter. All of that thing keeps people updated between now and then.
Very good. Thanks, Jay. We'll talk to you soon.
Privilege as always, Art. Thank you for having me.